morning, Green Spring. Today is, what is today? Tuesday, September 10. I'm Elke Martin, your host. And with me in the studio, we have Crystal Estep. Good morning, Crystal.
Good morning.
You all know Crystal because she is the practice manager at our medical center. And I bet since it's September, this time of year, you want to talk about the flu clinics?
Yes, we will definitely start off with the flu clinics. So we have started the flu clinics. Some people choose to wait till October, but all the individuals that are anxious to get a flu shot, we started off September 6th in Village Square. We actually had a bigger turnout than I thought because it's usually the least amount that we get is in Village Square, but we had 171.
Okay.
And there was no lines.
Wow.
Each year I think we get better with organization and how we do it. Mm-hmm. So with the flu shots this year, we sent out again the consent forms to everybody's cubbies.
Right. I remember I got one.
Yes, to try to make it easier because sometimes people need help from their families or their caregivers to do it.
So now you have to remember where you put that piece of paper.
You do. That's why we only did it a week prior. On the other hand, though, it's been really nice because the medical center committee, the resident committee, has offered to help us as well. So we did have some help on the first one. So if you can't see your consent form or you have any questions, we have people there to help you fill those out.
That's wonderful.
And I know in the past we haven't. So then we've had people standing trying to figure it out.
Yes.
It has just gone so smooth this year so far. Knock on wood, I don't jinx myself. Mm-hmm. But it's gone really smoothly.
Good.
And the second change that we made since last year is when you come into the medical center for a follow-up appointment, a routine appointment like your 3-6 month follow-up appointments, you can have your flu shot at that time. So you don't have to come back. You don't have to go to one of our flu clinics. If you come in for podiatry, the same thing. You can have your flu shot at that time. You're right there in the medical center. Let's get it done.
Do you have to call and say, I have my 6 months whatever appointment and I also want the flu shot, or will it just happen when you're there?
If you already have an appointment, we have an individual that will come into your room and give you the flu shot. You just let the doctor know while you're in there you want the flu shot as well. Once they're done, we come in and give the flu shot, you're on your way.
That sounds easy.
We're trying to make it easy because we don't want individuals to get sick, and I know myself, I'm a procrastinator. If I'm like, oh, I've got to walk all the way over there, why can't I just do it this way? So we're trying to make it as easy as possible so everybody gets the immunization. For labs, we were doing flu shots when you come in to get your lab drawn. We have figured out that there are certain labs that you come in for that we can't just give the flu shot right away. So you can ask at your lab appointment if you can have the flu shot. Some people might be told no, it's up to the physician on what kind of labs. Are we drawing labs because you've been ill? You don't want the flu shot if you've been ill. Acute visits as well, if you call the morning to be seen for nausea or I have a headache or I have a slight fever, we won't give you the flu shot when you come in at that time either. It would be ineffective. You know, so we're not going to give it at that time either. Although individuals have asked, and I understand why. You know, you want it at that time, but it's ineffective. It wouldn't help. So we're not giving those at that time. With the flu shots as well, tomorrow the 11th, we have from 1 to 5 in the medical center by appointment only. And what we do is we triple book at every 15 minutes, and we have room 10, 9, and 8, and we have 3 individuals giving them.
So it should run smoothly.
So it should run smoothly
you have
again.
3 parallel tracks.
Yes, yes. So it should run smoothly again. We're almost full for tomorrow afternoon. So if you want one tomorrow afternoon at the medical center, call now and make an appointment. There are other dates set up, and I do know we put a schedule in everybody's cubbies as well for the flu shots.
And so those by appointment only on the dates that were on the sheet we got, those are in addition to your appointment that you already have anyway with your doctor.
Exactly.
Either or.
Exactly. And if you can't make those ones that we have marked off just for the flu shots, and you call and I can come down such and such day, can I get my flu shot? If there's an opening in the lab schedule, we can put you in and do it at that time too. We're trying to make it as convenient as possible for everybody. Like I said, I know some people procrastinate, some people it's too far of a walk. We're trying to make it easy because it's hard to get the flu and recover so fast. We don't want anybody to be ill, especially after respiratory GI. I think that was our test
Yes.
to see how well we would do, but we just don't want a big outbreak, and we want everybody to be healthy.
Of course. Now, how do I think about it? Why would I wait, or is it better to not get it that early? I've heard some people say if you get your flu shot beginning of September, it won't last through the winter. Is that correct?
No, it's personal preference.
Oh, that's it?
It's personal preference, yes.
Oh, okay.
And it's some physicians, like outside physicians, will say, oh, get it October.
Yes.
Some will say, get it September. It's not any effective any longer than if you get it in September. It's going to keep you from the flu. So no, personal preference is how it works.
Okay, so you look at your calendar and you see when you have an opening there.
Exactly,
okay.
Exactly. Mm-hmm. Another thing with the flu shots that I ask, if at all possible, and we have had individuals do it, so I thank those individuals that have brought it in. If you get the flu shot outside of Green Spring, if they either call and give us a date and time and where they got it, or they bring down a copy that they got it so we can put it in their records so that we have that record that they did get the flu shot.
Yeah.
Now,
I think you're right. That's important for all of us to keep our records updated, and you do your part and we do our part.
If I don't get it, I have a system this year that I will know who's received the flu shot and who hasn't. You'll be getting a call from me probably the second or third week in October to ask why you haven't gotten your flu shot. If you don't want it and you deny the flu shot, call and let me know that too. And I'll just put it in your chart so we don't bug you. But
do we still have to sign that? Or maybe that was just for employees. I can't remember.
It is for employees.
Oh, okay.
Yep. Yep. The resident doesn't have to sign it. They can just verbally tell me that,
no,
they don't want it. Exactly.
Okay.
Exactly. But we are in full swing. So anytime you want one, just call, make an appointment, or we do have our flu clinics throughout the facility.
Or come to the other times that you have listed on the sheet that we got that are in community.
Correct.
You don't have to go to the medical center, right?
No.
I know you said you had this successful one here in Village Square, so I bet you have another one in Hunters Crossing and one in Town Center.
Yep, the next one is in Hunters Crossing next week. And then after that, we have the one in Town Center the last week of September.
Okay.
Between those are the ones that we have in the medical center by appointment only.
Okay. Well, good.
We're going to get you sooner or later, so you might as well just come get it.
Might as well get it over with.
That's right.
Okay.
That's right.
What else do you have for us?
Give everybody a heads up on the Medicare cards. I know last year, starting in April, I had mentioned we were getting the new Medicare cards that no longer had your Social Security number on them. It had a mix of letters and numbers.
Thank goodness.
Yes.
Yeah.
The only bad thing is we can't remember it now. So you ask for the Medicare number and they're like, oh, it's not my social anymore. So we did get a statement from Medicare that starting January 1st, if we do not have your new Medicare number, the one with the letters and numbers, they will deny the claim and it won't be paid and it will come back to you.
Oh.
Then it creates a huge mess for everybody. The one thing that I'm asking is look at your Medicare cards. If you do not have the new one with the letters and numbers, flip the one that you have over and there's an 800 number on the back. Call that and make them aware so that they can send you another one if you had one and misplaced it or you didn't get one. So they can send you another one because they are going to start denying claims come January if it's the old number. So by
now everybody should have gotten a new number.
Yes, ma'am.
Okay.
Yes.
Yeah, I was really pleased when they finally started with that. Because when I turned 65 and got my Medicare card, I looked at it, I thought, I can't believe this. For years they've been talking about don't use your Social Security number for data security reasons. And what is it that they do? They print your Social Security number right fat on the middle of the card there.
Exactly. Might as well have Social Security written on top of it. 2 cards.
Yeah. So that's good that they changed it, and we all have to make sure you got the updated number. And I think it's a good incentive to hear that they're not going to pay any claims. So I think we will pay attention to
and I agree
getting
100%.
Stuff paid that they should pay.
It's too hard to put it through again and again, and then the bill still comes to the resident, and that's it shouldn't be that way.
There's no reason for that, really.
I agree.
And you said you also wanted to talk about mental health?
So, as most residents are aware, we have Ashley Falcone, who is our mental health provider. I do have to say her schedule has been filling up like crazy. It has been very nice. She's a nice individual. If you would like to schedule an appointment with her, you can call the medical center. if you are unable to get out of your home, she will do a home visit the first time and then figure out whether to do home visits from there on out. But she is very flexible, here to help the residents, and I just want to continuously push that mental health is here. I wish they called it something different.
Yeah.
But that's what, as the corporation calls it, mental health. But she is a wonderful individual, and if anybody ever needs to talk to Ashley, she's available. And
that's good to know. Did she take over from Pat when Pat retired?
She did.
Okay.
She did. And I never thought anybody could fill Pat's shoes. And I know she's only been here for 3 weeks.
3 weeks?
She's only been here for 3 weeks.
That's really new.
Although I do have to say, I thought it was going to take a lot longer for her to fill Pat's shoes, but Pat would be proud if she walked back in and met Ashley.
Good.
A lot like Pat's personality.
That is very reassuring to hear. That is great.
It's reassuring to us too.
Yeah, I bet.
Because that's what you need.
Yeah.
So she is available too.
And over time, she will grow and get better and better. I suppose.
I agree.
As she gets used to life at Green Spring.
Yes, and very outgoing. She's even helping with the flu shots so that residents can put a face to the name.
Yeah, that's good.
Yes, very outgoing.
Because
individual.
Particularly with all issues around mental health, you need to have a face and you need to know that you're able to make a connection.
I agree.
Otherwise, you're certainly not going to open up.
Yes, I agree.
Okay, well, we covered quite a bit of ground here this morning. Any closing words? We're coming to the end, Crystal.
Not too many closing words. Just like I said, get your flu shot. It's very close to my heart because I don't want to see any individuals ill. It's just too hard to recover from. So I like I said, I'll find you if you're not on my list of getting it. I'll find you.
And I think we've had enough of closing down common rooms and groups and all that stuff. We want to stay away from that too.
I agree. Okay. And it just spreads so fast.
Thank you so much for being here today, Crystal.
Thanks for having me.